Welcome, everyone. I am so delighted to be moderating this panel about women's issues in psychedelics. I'm really excited to have such an amazing group of women here to speak about this topic. My name is Adele LaFrance. I'm a psychologist from Canada, now living and working in the United States. And I just want to take a moment to have each of these women introduce themselves so you get a sense of who we are. Kata, would you like to start?
Sure. So my name is Katalin Kalman, and I'm also from Canada. I live in Vancouver, BC, and I'm a registered clinical counselor. I work with trauma, developmental trauma in my practice, which is birth trauma, prenatal trauma, early childhood trauma, and I have the privilege to work with women who have had a psychedelic experience, and they bring it into the therapeutic space, and I do processing and integration work with them.
Thank you so much. Welcome, Jess.
Thank you.
Hi, I'm Jess Poicha. I've been working for the last 2 years in Guatemala, serving plant medicine and other ancestral medicines with my husband. And what drew me to this panel was that working with and facilitating these ceremonies has helped me grow immensely and embody as a woman and has prepared me for childbirth and motherhood like nothing else could possibly do.
Thank you so much. Glad to have you. Sachita?
I'm in San Francisco, California, and I work as a somatic sex therapist, as a visual artist, and as a full spectrum doula.
Thank you. Welcome. Anya?
Hello, I'm Anya Loizaga Welder. I'm a Mexican-German clinical psychologist. I've been working for the last 25 years close to indigenous healers in the bridging of the indigenous use of sacred plant medicines and Western psychotherapy, and also a researcher in psychedelic medicine and the psychotherapist.
Thank you so much. Jelaine?
Hi, I'm Jelaine Andrews, and I live in Marin County in the Bay Area. And I began my clinical work in this field using MDMA in a phase 2 study for anxiety with life-threatening illness. And that led me to be working and developing the use of ketamine as an assisted psychotherapy. So most of and I'm doing that currently, and also working with MDMA in phase 3 for PTSD. And most of my population would be treatment-resistant depression and anxiety, and obviously a lot of PTSD work as well.
Thank you so much. Melissa?
Hi, I'm Melissa Whippo. I'm a licensed therapist. I live in Berkeley in the Bay Area, and I work with ketamine-assisted psychotherapy and research about how ketamine-assisted psychotherapy can help with women's health issues, namely postpartum depression.
Thank you so much. Welcome. And so before we start, we just wanted to thank our mentors and our healers who have supported us in such a way that we are able to be here and participating in this panel, speaking for people who maybe don't have a voice or don't have these opportunities to use their voice. And so really want to honor all of the people who have come before us, making this possible. We also want to thank all of the people who are interested in supporting women's issues. We have a long, challenging history at times, and we're not quite there yet. And so hoping that this panel will both shed some light on concerns that need to continue to be raised, but also we can celebrate some of the ways in which we've been able to move forward together in a really good way. In fact, I'd love to start in that way. And so I'm wondering, Kata, you've talked about how psychedelics can be particularly empowering for women. Could you share with us your experiences about that?
Yes, so for me, the social aspect is just as important as the individual aspect when I do this work, when I do my counseling work, my therapeutic work, because I believe that we need healing both on an individual and on a social level so badly. And preparing for this panel, I had a look at my case notes, and I realized that my first female client who brought in a processing and who brought in a psychedelic experience into the therapeutic space came in 2017, which is the year of the Me Too campaign. It might be a coincidence, yet I find it a beautiful coincidence, because what I find in my practice is that those clients of mine who haven't included psychedelics in their trauma work are not as empowered socially as the ones who had the chance to work with psychedelics. And please let me emphasize it again that I only do the processing and integration. So they bring in like an ayahuasca experience or whatever they manage to have on their healing journey. And those are the women who find their voice, who have the courage to make a change, who can speak up for themselves, who can change their life completely, even at the age of 30, 40, 50, 60. So that's something that's beautiful for me to see. And I really would like to emphasize. So that's what I meant when I said that I would like to emphasize the social aspect. The socially empowering aspects of psychedelics. The difference is just striking between the two populations in my practice.
And Jess, you also mentioned, the empowerment that can come with psychedelics use. Can you speak about that as well?
Yes. Well, it's just that the medicines can take you through your shadows so much that it really brings the power as you come through the darkness. You get to look at who you are. You get to examine the stories that society tells you about who you are and what you really believe about yourself. And you get to experience yourself as your true nature. And that really, the more you do it, the more you do that and practice that, the more it shines through and helps you become the person you're meant to be.
Thank you. Anyone else?
Is it okay if I just add just a little bit? It's so beautiful what you were both saying, and with my work, I think to add to that, not to be any sort of bias against all of our male clients who go through trauma, so many traumas as well, but this is focused on female, and I think some of the power of psychedelic medicine in helping women with early trauma is that, and this is for our audience who may not understand how it works, but that sometimes it's very hard to look at a past experience. We tend to shy away from it. We tend to turn our heads from it. We don't want to go there because it's painful. And having a psychedelic experience, the right psychedelic for the right person, enables that person for the shame and the fear and the guardedness to drop away, and then they're able to process and talk. And processing can just be actually talking and remembering, and to be able to remember and talk about without being emotionally charged and in fear, and to be able to talk it through. And the medicine wears off, but the next day and the weeks after, the fact that one was able to be there with her trauma, with somebody that's able to listen and help and guide through that is incredible. And I think when you're talking about the difference in your population for women who've been able to experience it, just for our audience, that's one of the reasons. There's many reasons. That's one of the reasons.
Thank you so much, Julian. And so it makes me very aware of the unique challenges that we women face in this particular time in our culture around issues relating to pregnancy and motherhood from all of the different angles. And so I would love to hear from some of you who would like to share about what you've learned either personally or professionally about these women's issues that are just so, so, so important.
I wanted to add something regarding empowerment. The first thing that this reminded me of is just how powerful psychedelics have been for me in reconnecting with my body, and how these medicines, the first place where I have experienced my own empowerment has been through my body and reclaiming my body. and re-entering my body, my proprioception, and my sense of safety within myself, and confidence and connection and intuition. So for me, psychedelics have really started with empowering me at the physical level, the embodied and somatic place. And it's been an amazing journey to ask medicines to help me reconnect deeper, and also organically how that typically happens in most of the sessions I have participated in.
And you've mentioned that you actually do work with women around pregnancy and abortion and so on. Would you be able to speak to that point as well, in terms of what you've learned or experienced or feel is important to share?
Yeah, I mean, I try to encourage people I work with, and even myself in my own practice, when coming to work with medicines, to really use it as prayer and invocation. And so if someone is working with pain or emotions and intensity and memories around something like an abortion or a miscarriage, how can they create that ceremonial space to help heal from that? How can they really amplify their prayers and voices up? How can they ask for guidance? For myself personally, I'm trying to make room to become a mother soon. So I personally like to use ceremonies now, really in creating space for my room, whether that's visualizing it, feeling it, using my hands and touch during ceremonies to bring energy to my breasts, my belly, my stomach, my yoni. And so those are some of the ways I can really, I see how medicine work can help women pray and process after ceremonies, help integrate their experiences.
Thank you. And Anya, do you have anything to add about that topic around pregnancy, abortion, any other issues related to this particular topic?
Yeah, first I want to share, I'm a mother of 3, and I had the experience that the ceremonial work with ayahuasca that I had the opportunity to do in Peru first really connected me and prepared me for pregnancy, like having a vision about my first pregnancy before I even conceived my baby, and then allowed me really to be connected to her while she was in my womb. Like, from my experience, being a mother is the most important initiation process a woman can undergo. So I felt, I experienced that this work with plant medicine really prepared me strongly for it, and especially for the birth process. I relived the first time I gave birth really as a ceremony, the same way this energy of life, like just wrapped and allowed me to have a very, very ecstatic birth and easy birth also. Like, it's the same process, like of letting go. And that's something when I do integration work with patients, is also like helping kind of this integration of a birth process of the psyche again. Like I do conceive the work with psychedelic, like somehow like giving birth to ourselves again. So in this way, I feel it's very, very strong related to what we are in the essence as women, also as those givers of life in this way.
Thank you. And Jess, I know that it's a big part of the work you do and your experience. I'd love to hear from you about this.
Yes, well, I had a couple of points I wanted to bring up too. As far as becoming empowered as a woman, and also preparing for childbirth and preparing the womb, it's not psychedelic all the time, but a lot of times you have plant dietas that go along with ayahuasca and other psychedelic plant medicines. So you do plant dietas first. And my personal experience with that, and also working with many women, is that the plants will really clean out that energy center. So much so it can really change your cycle the first few times you do a plant dieta. And that was definitely my experience. And I've definitely had the personal experience of having the space cleared out to make room for a child. And I actually heard the voice tell me, like, I'm making space here for something for you, which was really amazing and fantastic. And also with sexual trauma, and even like, sex is the most powerful energy exchange we can have with another being in this lifetime. And it leaves an energetic signature in your energetic body. And the plant dietas are so powerful for cleaning that out when it needs to be cleaned out. I think it's so important for women who have had any kind, and I think most of us have had some kind of sexual trauma, to seek out the plant medicines, and specifically plant dietas, that go along with the psychedelics. Those are so healing and so important. And as far as my motherhood goes, and my pregnancy, and also visions of my child and knowing him before he was conceived, I think these medicines, both ayahuasca and kambo, even though, again, not psychedelic, but they helped me to integrate intensity in such a powerful way, and really expanding my energetic channels so that I could accept the intensity of it. And it also made my childbirth ecstatic and beautiful. And I don't know, is easy the word? It was magical. That's my word.
It's amazing. It's like, not only do these substances have such healing powers, both on a societal level, but also on an individual, emotional, physical level, but they also can help in all of these other amazing ways, right? So that's this empowerment, this bringing grace and ease to what it means to be a woman in our culture. And so thank you all for those examples and those words of wisdom. And Melissa, I would love to hear from you. I know that one of your topics of interest is relating to safety in the psychedelic spaces. And so would you start us off on that topic?
Yeah, I'd love to. Thank you. And I just, if I can just add briefly about the womb healing and the pregnancy work. I do feel it was offered to me once in a plant medicine ceremony that our womb can be our altar, that we carry our altar with us. The womb is such a powerful place. And I think for women in the psychedelic space, particularly in the ceremonial space, which can be a very masculine space, we can become quite vulnerable, and we might not be aware of our vulnerability. I know there's a lot of different traditions that a woman who is bleeding, who has her moon cycle, is asked not to sit in the circle. And partly that's because of the power of the womb space, of the space of creativity and creation. I've birthed 3 children myself, and I find that safety is of the utmost importance, that there can be actually quite a lot of harm done to a woman in the psychedelic space, in the ceremonial space, if that vulnerability is not acknowledged and respected and held with the utmost respect and dignity and sacredness. It's such a sacred space. I find that a woman is especially vulnerable during pregnancy and during the postpartum setting. And we want to be really mindful about entering the psychedelic space during those times, because it is, I think it can be misconstrued sometimes and also abused. I think that a woman's vulnerability can very easily be abused, and it's not even, I don't know that it's intentional always, but it is such a powerful space. And I have found in my own experience that the circles that I have sat in that we're all women, were some of the most powerful, because the level of safety was exquisite. It was there, it was held with so much dignity and so much respect. And I'm not saying that men can't do that. I think part of the divine feminine includes a healthy masculine aspect. And so that I find to be a really interesting invitation in this work. How do we join and invite safely the masculine and the feminine to work together, really honoring the power and sacredness of the feminine energy, and particularly for younger women, who can be taken advantage of, which unfortunately I have seen happen in the medicine spaces. So I find it to be really important that we are constantly thinking about protection and safety and the use of touch sometimes as it arises in the psychedelic space.
Thanks, Melissa. I was just having a conversation with a friend of mine this week who's a reporter for around psychedelics. And so he's spoken to many, many men and women about these different topics. And he was sharing with me that he was speaking with someone who had an experience of having sex with their therapist in the context of medicine work, and who felt like it was very powerful and positive. And I was really struggling to metabolize that, because I felt like that was impossible, because of the power dynamics and because of the inability to consent and because of the trauma being weaved into the space and the relationship. And so I was really glad to hear you talk about like the unconscious hurt that can happen. It may not even be conscious. And so, Kata, I'm wondering if you have anything to add to this topic, this conversation.
I actually am more into the psychedelic. I'm more into the processing and integration phase, not so much so the therapeutic experience itself. And thank you so much for the chance, because I wanted to add this piece that we remain raw for sometimes months or even maybe a year or year and a half after a powerful psychedelic experience. And the feminine presence, the holding, the love, the warmth, the connection, Julian, I think you mentioned that, inevitable, not only in the medicine space, not only in the medicine zone, but months afterwards. And I find this sisterhood mentality very important, like connecting female people who worked with psychedelics, creating a network where they can speak the same language, where they can share their experiences, even if they are in different parts of the world, especially now with COVID. We are separated, but we have this wonderful chance to connect through technology. Sisterhood is so very important. Everything that you have said, just to have a shared space, to have a shared experience afterwards, following the medicine experience itself.
And if I could just add one thing, and it's Melissa, thank you so much for bringing up safety. And most women are safe, but having a group being held, having other people know that you're having this experience, and women are vulnerable. They have been throughout history, and men can take advantage of that, and especially if they're in a healing position, a therapeutic position, a power position. And I think I personally know, and I'm sure many of you know, of stories or instances where this has happened. And I was in a situation a while back, and it's a dilemma. And I don't know that there's a solution, but I think it's important to talk about, just to do with safety. So many of us are connected in this world, and we know practitioners. And when we find out about something that has been untoward, or somebody has been harmed, but they really don't want to talk about it, there's shame around it. They don't want to out the person, and yet we know about it. And I think especially women in our circle, in our position, I think it's really important that we have a way of communicating, and not just have it be the old, I want to call it the boys club, where in politicians, it's in the medical world where people in a particular practice protect each other. And it isn't okay. And to have a way of, like, if I went and said something to other people about what I knew, I might be looked on as, oh, she went and, she didn't keep confidentiality, or she went and did something about that. And it's a real hard place to be, because if you're not supported, then how do you go and do something about it? So I've had this conversation before, but, I think in the future, psychedelics are becoming, more accepted, more popular, and there will be this underbelly. And I think we do have to have a way of protecting and maybe policing, although I don't like that word, but doing that for people that we know or even don't know.
You're absolutely right. And there is, I know what I've heard from people, there's, that people are worried about speaking up, especially if it happened underground, because of the implications for them, for the others, for the work. And so I think there still remains too much silence and too much suffering. And so I really am so excited that so many of us are working towards the legalization of these substances, the medicalization of these substances, so that we can bring it into the light and serve people in a way that is going to be far safer for people who are vulnerable, people who are at risk, not just women, but in general. Thank you. Yeah. Anyone else like to comment on this particular topic? Sachita?
Yeah, again, with the word safety, not only does that bring to mind, like we're talking about sexual boundaries and consent, but also how can we create safe spaces for people of color and queer people, people with different sexual identities, other than, and it just reminds me of one day I wanted to invite a trans woman friend of mine to a ceremony, and I thought about it, and I actually hesitated because I was concerned that bringing her into the circle I was part of might not be a great fit. I wasn't sure where everybody was at, and so I think that's something that's close to my heart, is making sure how can we create safety for Black, Indigenous people of color too. And yeah.
Thank you so much for bringing it up. I really wanted to mention diversity, and just so you see the numbers, I have been providing processing and integration support for 6 years now. And so far I have had one female client of Chinese background and one female client of Punjabi Indian background, and that's it. And as for my male clients, only white. So there is something that we need to do. I'm very happy, Sachita, that you brought it up. I don't know what, but look at us, beautiful white women, all of us. There is no diversity, neither on the service provider side nor on the recipient side. And these are big questions that we must, we just must raise and must talk about. I don't know any solutions, but I'm very happy that now we are talking about this as well, this aspect as well.
Anya, would you like to add anything about this particular topic?
I think it's important we speak a common cultural language, like to have really the sensitivity of the culture also. And I do think in this sense, it goes beyond the color of the skin also. It goes really into an empathic understanding where the other person is really at. And making from this place a safe space. I think this is very important, like in terms also of preparation for such an experience, and a fit in between this person needs and the provider. And I do think sometimes there's not enough care in this particular aspect. I would also like to add, you asked me before about abortion, and I did not speak about it. I do think that psychedelics provide a space for a grief process that is oftentimes not concluded, because many people have this physical experience of abortion, but not this space of really bodily and psycho-emotional assimilation of this loss, right? In many ways. So I do think that psychedelics can provide this inner space. And also sometimes like physical trauma that is held still in the womb, that starts to move, like our uterus is very strong connected to our emotional body. So there's sometimes there's little muscular movements that can connect emotions that are released in this way. So,
Thank you.
and I do think that integration is very important for these processes. Like sometimes not the psychedelic experience by itself is not enough. So in this sense, I think it's very important, like this bridging of the experience and then the being held, especially when coming in touch with something so deep, right?
Thanks, Anya. It's really beautiful. And I'm really so grateful to know that there is more and more healing for all that is emerging through this work. Related to pregnancy and childbirth is issues around medicine use while breastfeeding, and also childcare, and I know, Julaine, you're doing with others, you're doing this really beautiful work looking at safety related to the use of substances, because there are so many women who could benefit from participation in clinical research trials about MDMA or psilocybin, but who are excluded if they are pregnant, hoping to get pregnant, or breastfeeding. And so, Julaine, could you tell us a little bit about the groundbreaking study that you and others are doing around this topic?
Sure, and please, Melissa, because she's working right next to me. We're working together on this. I've been working with ketamine for about 5 years now, and not everyone's familiar with it, but it's amazing medicine, and it's incredibly safe. And one of the reasons I'm attracted to working not just with ketamine but with other medicines is that is the rapidity of change that I see. And when people come to us and they have tried everything for many years, and medicines fail, or they work for a while and they fail, and then ketamine works. And women in particular, because of, and Melissa can speak to this too, because of hormonal reasons, they can be more vulnerable to anxiety, to depression. And what we know is that we've used ketamine with women at the beginning of their cycles, women who have what we call dysphoric PMS, who suffer more than another woman would, as far as anxiety, anger, insomnia, depression. And Phil and I, we knew of a woman who she was in our practice, and we just, like everything else that people invent across the world, we thought, oh, why don't we try to use ketamine with her? Because she had anecdotally said that she had done a ketamine session a few days before her menstrual cycle, and she didn't have PMS like she does every month. And so then we started working towards that. And when Melissa came to work with us, she has this unique position that she can talk about. She works with women with postpartum depression. And so we thought, let's do a study. Let's do a ketamine study where we can trace the metabolites through breast milk, so we know when it's safe for a woman to use ketamine. And at first we thought, well, Johnson & Johnson had just come out with Spravato, so of course they have done that. And I researched that, and they hadn't. There had only been a rat study, but never a human study tracing the metabolites. And so, so we did that. We did it at our center. Melissa was a big help because she has that population. And so we've completed a study of tracing ketamine, where women pump their breast milk. And so we know its safety and efficacy. And we're in the midst of writing that paper up and publishing it. So that's one thing, that ketamine, and they haven't, we know the half-life of MDMA and psilocybin, but nobody has researched it that way, but that will come. I think it's really, really important that a whole population isn't banned or afraid to use psychedelic medicines because of being a woman. So doing the research is important, and taking the time to do that is some of what we're all about. Melissa, would you please add to some of that?
Yeah, I'd love to. And thank you for sharing all of that. I mean, we know that postpartum depression is the #1 complication of pregnancy in the US. And there's so many factors that contribute. But over the past decade that I've worked in women's health, most women, so many women, probably 80% of women, feel really uncomfortable taking an antidepressant medicine. The studies about antidepressant medicine in breast milk are pretty limited, and the Western medicine errs on the side of it's safe, but the studies are really limited. And so there are so many women who are, you know, in a very deep state of depression, or who have birth trauma, or who had trauma that was exacerbated by the birth experience. And, you know, we really, you know, we feel so strongly, as Julian said, about ketamine being such a good and safe medicine to treat severe depression, anxiety, and trauma. And it's so exciting that, you know, it's also an inexpensive medicine, so it could be very accessible. I don't know if people know this, but last year a medicine was introduced called brexanolone that's cost $30,000 to administer. So it's very limited who can access this, and you have to be hospitalized. It's an infusion treatment, very disruptive to the attachment relationship with mother and baby, and also very disruptive to the breastfeeding. You cannot breastfeed when you're doing this infusion treatment over several days. But what we're so excited about is that now that we have data about the safety of ketamine with the lactating mother, that she really could plan for a day. And again, this goes into the childcare piece that you were speaking to, Adele. She would need a day to have the treatment, to receive the medicine maybe in the morning, and then by the evening, she would be able to breastfeed her infant again. So if she was able to have support and childcare for, you know, 10 to 12 hours for that day, it also, the secondary benefit of the ketamine work is, you know, as I've learned from Julaine and Phil, it's the timeout effect. So it's not only the medicine working to rewire pathways in the mind and to work to leave the trauma in the past, but it's also the benefit of having the timeout, of the restful property of the ketamine. And I'll just share briefly about my first experience with ketamine during the training. I actually re-experienced my own birth. Being birthed from my mother was quite traumatic. And I had such a breakthrough with the help of that medicine during the training when I was learning how to work with ketamine, that it just solidified my feeling that I really feel called to help mothers in this space. And I feel really honored. And I feel, you know, just to weave in the piece, the conversation about diversity and inclusivity and cultural differences, there are, you know, primarily white people working in this space. And so as a white woman, one thing that I really like about this medicine is it is inexpensive and it can be accessible. So I'd really like to see us be able to bring in more practitioners of color to offer this work. And I think it's going to have a huge impact on the way that we are able to treat postpartum mood concerns, which is not just depression, it's anxiety and trauma and other things.
Thank you so much, Melissa. We're going to get ready to close, but I did want to make a comment. We've talked a lot about motherhood and being a mother, and I just want to honor all of the women who are watching who are not on a path towards being a mother in that sense. And again, just sharing my personal experience of really being able to come to a place of embodying that truth inside of me and actually celebrating it, you know, because there's all of these pressures about what it means to be a woman and so on. And so one of the other potentials that I see with psychedelic medicines is to actually broaden our understanding of who we are and who we can be, so that the identity of woman can actually expand and evolve in a way that there's really no one left behind, no matter what their life circumstances are or their life choices are. And so I'd like to close this panel by inviting each of you to share a last comment or thought, piece of advice for the people watching. I also want to thank the individuals that we surveyed in terms of topics that they wanted to hear about. So thank you for giving us your words so that we could do our best to honor them in this space. And so, Kata, would you be willing to start us off with the closing ceremony?
I think I would like to emphasize sisterhood among practitioners, sisterhood among clients, among people who receive this medicine during medicine work, following the medicine work, creating a same language, creating a safe container where we are all held with no rivalry, no jealousy, no comparison, but arriving at our true selves and connecting from the heart.
Thank you. Jess?
I would say one of the most beautiful things about working with these medicines and watching other people work through these medicines is seeing their bodies both physically and energetically open to receive the intensity of experience. And I think that's really especially important for women, but not just women, but and humanity as a whole in this moment. So, thank you.
Thank you, Jess. Sachita?
Yeah, I wanted to continue with the sisterhood in that to share your resources and to share your wisdom with others and to share and redistribute your privilege to others and to be aware of that. And that we can all do our best to not spiritually bypass here. And really, for me, what's very important is distribution of information, wealth, resources, and access to these medicines. So if there's a way that we can be less secretive about it and share with others that don't have access to it, the better. I think we need to open up these gates to others.
Thank you. Anya?
Yeah, I just want to add also this perspective of finding these inner treasures of who we truly are as women, those intuitive wisdom that is within all of us, this great grandmother, this young child, this powerful woman in its own uniqueness. So I think we can be in this way mirrors to each other. Mm-hmm.
Thank you. Julaine?
I just want to add, and this just is coming to me as I'm with these women right here, what we didn't talk about, but it's very true, is that this is a male-dominated field. Psychedelics have been forever. And women, it's important to all of us here, talking to all of you who are watching, to bring a voice to women, and knowing, and this isn't in any way to negate men, but I know that if this panel right here is different, the feeling is different for me, even though we're on Zoom, it feels very different than I know it would feel if this was a mixed panel. And so that tells me something, that there is everything we're talking about, safety, comfort, that there is power here. And for us, sometimes it's hard to have a strong voice in a male-dominated field, but just to bring our own beauty, nurturing, safety, and what's important about who we are to the field itself by speaking up like this. So I just want to thank all of you for that.
Thank you, Julaine. Melissa?
Thank you. And thank you to all of the women on this panel and to you, Adele. And I really want to echo the note of sisterhood and inclusivity. I think part of being in a patriarchal society means that we are encouraged to be divisive, to be in competition, to be in comparison, and to know that each of us has something important to offer and that there's room for all of our offerings. And the more we can encourage one another and collaborate and share, as so many of you said, I think we'll just continue to dismantle these outdated systems that are more patriarchal, and the more we will continue to lift up this important sacred feminine energy that is rising.
Thank you. And I would just say that I would love to grow this idea of sisterhood to include all of our mothers and their mothers and their mothers, because I know that when I think about doing this work, I do it not just for me and for the people around me and for the people coming up next, but for the women who came before us, you know, who struggled in really unique ways and who fought in really unique ways and who helped pave the way for us in manners that I'm not even sure they appreciate, you know, what they were able to do. So I just want to honor all of the women who have come before us. So thank you once again, everyone, for your participation, your heart, your wisdom, and I have no doubt that we will be able to, you know, reach some people who maybe need to hear some of these messages today. So thanks again.